refuting my opponent's claim that universal healthcare is not efficient because it's run by the government. In a lot of ways, the universal healthcare system will be more efficient than our current system, because the universal healthcare system will lead to more efficient and streamlined medical care. According to Julie Sikora of Livestrong.com, every patient means filling out more paperwork with repetitive and sometimes erroneous information. The universal healthcare system automates and standardizes medical records, which can be accessed by all participating entities. Fully integrated electronic medical records contain complete and accurate information and rid healthcare organizations of walls of paper files. Good information leads to better decision-making by physicians, which decreases medical errors and the practice of defensive medicine to avoid malpractice suits. Also, a single-payer system would promote greater accountability to the public. According to Public Citizen Health and Safety, the creation of a single-payer system would provide an opportunity for creating a system run by public trust. Benefits and payments would be decided by the insurer, which would be under the control of the divorce board, representing consumers, providers, business, and government. That protects the universal healthcare system from being corrupted by the government because it will be run by the people. Also, a universal healthcare system will actually be less bureaucratic than the current one. According to the Physicians for a National Health Program, the United States has the most bureaucratic healthcare system in the world. Over 31% of healthcare dollar goes to paperwork, overhead, CEO salaries, profits, etc. It's not necessary to have a huge bureaucracy to decide who gets care and who doesn't when everyone is covered and has the same comprehensive benefits. With the universal healthcare system, we would be able to cut our bureaucratic burden in half and save over $300 billion annually. Also, my opponent made the claim that universal healthcare is socialized medicine. According to Physicians for a National Health Program, universal healthcare is not socialized medicine. Socialized medicine is a system in which doctors and hospitals work for and draw salaries from the government. In universal healthcare, the government pays for care that is delivered in private practice and are paid on a fee-for-service basis from government funds. The government does not own or manage medical practices or hospitals. And also under the universal healthcare system, care will still be provided privately by your local physician. According to Physicians for a National Health Program, the single-payer system would not be socialized medicine. It would be socialized insurance. This means that society pools the risk so that the people who are really ill get treatment. In this system, healthcare is still delivered privately by your local doctor. So the government won't be making decisions that are life or death, that should be just between the physician and the patient. It'll still be between the physician and the patient, but we'll just be pooling the insurance. I'd also like to respond to the claim that healthcare will be more expensive. The universal healthcare system would allow America to spend less on healthcare costs, because as I already said, drugs can be purchased in greater bulk, and services can be negotiated at a lower rate due to the larger pool, and so on. And also, it will reduce administrative costs. According to Julie Sikora of Livestrong.com, since universal healthcare is typically managed by a government agency and a single-payer system, administrative costs plummet, resulting in affordable or free healthcare to every American. The last claim that I'd like to respond to is that they claim that healthy people who take care of themselves will have to pay for the burden of those who smoke or are obese, etc. Universal healthcare will lower the cost of healthcare because people will be able to seek preventative care rather than expensive emergency care. According to Healthcare TAC, because the uninsured don't have access to treatment when the health problem first occurs, they don't seek medical care until it becomes a much more serious situation. Emergency room care is very expensive. It would cost less to either pay for preventative health care or to treat the health problem before it becomes a more serious situation. So it's cheaper just to have everyone pay the same flat cost and then seek other insurance if they need extra care. And then it will be spread out evenly and everyone will receive the care that they need.